hit me up if you're interested in that. But without further ado, let me bring my guest to the stage, give her a proper intro. Dr. Teju Williams is a family medicine physician with more than 12 years of experience. She's passionate about educating people on how to reverse chronic disease using food as medicine. She understands firsthand the impact and burden of disease, and through her own personal study combined with conventional medical training, she discovered God's design for the human body and the foods that best provide the necessary building material for optimum health. She is also quite passionate about dealing with emotional trauma and effectively managing stress as an important aspect of healing. She feels called to share this message of hope that healing is possible. Dr. Teju, how are you?
I am doing fine. I'm doing all right. Thank you. Thank you.
Yes, yes. So let's dive in. I feel like we got so much to talk about, and again, appreciate you taking the time on your Sunday to come in and bless us with your wisdom.
Absolutely.
So, starting off, can you break down the difference between an MD and a DO?
Okay, that's a good question, actually. So, here in the United States, there are two ways that you can be a practicing physician. You can go the conventional MD route, or you can go the DO route, which DO stands for Doctor of Osteopathy. And really, at the foundation of sort of how we view medicine is we take the human body and we look at it as a whole, as a unit, mind, body, and spirit. So that's sort of the distinguishing difference between an MD and DO. We also learn how to do body work. So you can think about a chiropractor. We do a lot of chiropractic work, trying to help the body to be realigned. So that's kind of sort of really the difference. But in it really, as with everybody, people know this. You can see a DO and an MD as a family medicine physician, which is what I am, or as a general surgeon, or as an OBGYN. We just have that core value, and we sort of look at medicine through the lens of the body as a unit, my body and spirit.
Okay, and so from the doctors that I know, the MDs, and from what I hear on different like shows and everything, how much well, I'll say this, they say that nutrition is not a major part of the curriculum of what they're learning, right? Is there a difference between what your DO? Are you guys learning more about nutrition and how to heal the body naturally, or is that more so just personal diving in for your practice?
Yeah, unfortunately, in the DO space with medical school, we don't learn much nutrition. I think I took maybe a short course on sort of the history of medicine, and nutrition was kind of factored in, but it's not a major part of what we learn. So really, in essence, both MDs and DOs really don't get any, very little to any education on nutrition. So if you find an MD or DO like myself, know that we've gone the extra mile to learn that for ourselves.
Right. So then what led you to like embrace the concept of food as medicine?
So I've had my own journey with poor health. So I come into this space not just as one who is medically trained, but also as a patient. And, when I first, so just a little background about myself, I was actually born and raised in Nigeria. So as a little girl, I knew that I always wanted to be a doctor. And so, I kind of went through school there, and then I moved to the United States at the age of 10, and I found myself in one of the blue zones, Loma Linda. So I actually,
Hmm.
I went through, high school there at Loma Linda Academy. And of course, I joined the Adventist faith. And a big part of what we are taught in the Adventist faith outside of just the Sabbath truth is the importance of nutrition. Health reform is a big part of what we teach as Seventh Day Adventists. So I already had that exposure in high school, and so I went on to college, and I kind of knew that I wanted to merge nutrition with medicine, but I didn't know how that was going to happen. And in the back of my head, I always felt like you had to be a doctor in order for you to actually help people from a nutritional standpoint. So I, matriculated through medical school, and as many medical students will tell you, as many doctors will tell you, you kind of go through a phase of burnout, and that happened with me. And at that point, I think I sort of thought to myself, okay, what was happening? I needed to sort of look at the reasons behind why I was burnt out. Chronic stress. I was under a lot of stress, and I wasn't eating well. Even though I was a vegan, I was a junk food vegan, and I wasn't sleeping, and all of the things that happen to you when you're a medical student, and that led to burnout. And so I started to have symptoms. I got sick. I would go to the doctor. They would say nothing is wrong with you. And this went on for years. And at that point, I realized that I needed to take matters into my own hands. And that's kind of what led me back to the study of nutrition. And really, I had to dive into that so that I can help myself. And in helping myself, I was able to also learn the information I needed to help my patients.
And so you said a lot in that. You said that you were a junk food vegan. Break down that, because people have the conception like if you're vegan, you're automatically healthy, but that's necessarily true. So what is a junk food vegan, and are you still vegan now?
I am, yeah. And I love the term vegan, but I think when I'm in the space of like reversing disease. So I really like to make it very clear that whole food, plant-centered diet, which obviously is a vegan diet, is really essential in helping to optimize your health, improve your immune system, and help you to prevent disease, and in many cases reverse disease. So yes, being an unhealthy vegan, a junk food vegan, is just as sure of a way to get sick as not being vegan. It's the junk food, it's the highly processed food, it's it's all of the stuff that Oreos are vegan, right? But they're not healthy. And they're not healthy because they lack all of those protective compounds that keep us healthy. So yes, I was definitely a junk food vegan.
Yeah, I think a lot of people start off that way because
Mhm.
you don't really know what to eat when you're transitioning. And so like the carbs and all of these different things are the easy things to grab. Can you break down what is the sick care versus the real care system?
Oh, yes, 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 yes. So when I went through medical school, actually before I went through medical school, I was like ecstatic because I just felt like the best way to um, make a difference in the world is to be a part of the healthcare system. But as I matriculated through medical school, I started to realize, and it happened very slowly, but it happened. I started to realize that our system really wasn't actually dealing with getting to the root cause of why we were sick. We were just mainly treating diseases. We were actually treating symptoms of these diseases, of these conditions, using medication, using drug therapy. And I would take care of patients, and they would come back. It was like a revolving door. And I quickly realized that we actually, as we know it today, we are living with a healthcare system that is what I define as a sick care system, versus the real healthcare system, which is really taking matters into your own hands. We need to help people understand that at the root of many of these chronic conditions, the majority of them, not all, but the majority of them, have their origin in diet,
Mhm.
poor nutrition, poor lifestyle. So in order to actually deal with the problem at the root cause so that you can reverse it, as opposed to just treating and managing it, we need to focus on what's causing those issues to begin with. And so that's that's what I call the real healthcare system, is really getting to the root cause, and really focusing on what you can do as an individual to improve your health outcomes.
Mm. You mentioned like taking our health into our own hands, and like I wonder why we trust others with our health more than ourselves. Like I have a family member and I sent him a video and I was like, hey, you should watch this. I think it can help you to reverse like what you have going on. And his response was, that's not really my thing. And I was like, what do you mean? Like healing yourself and educating yourself is not really a thing. And so like how do you take a patient from, giving you all of their trust into instilling that trust in themselves and learning their body and how to heal the body themselves?
Yeah, I like what you said. I think it's important that we make note of the fact that we are living in a society where we've been conditioned
Hmm.
to seek for help outside of ourselves, outside of our creator. And there's nothing wrong with getting the knowledge, getting help when that help is going to be beneficial in the long run. But what we've now done is we've taken a lot of that accountability and ownership away from ourselves, and we're looking to the outside for everything, not just in healthcare and everything. And it's not panning well for most of us. We're not any better as a society today as a result of that. And so what I try to do is I try to help people to understand that knowledge is power, knowledge is key, and I come from a place of educating folks on, once you know how the body functions and you understand what the body requires, then you do feel empowered, because it's really not as difficult as you might think, right? You think you
Hmm.
have to be a doctor, or you have to be super educated, you have to have a nutrition degree. It's not like that. Our body is beautifully designed by our creator, by God. And there are certain health principles that we have to know. And once we know those health principles, we can start to put them into effect and we can see real results. And that takes you being a part of that. So I really try to help my patients understand that it's really all about you. Like, the ball is in your court. I can help you to an extent, but at the end of the day, it falls back on you. And my goal is to help them to see that it's possible. It's that they have more power than they think. I think a lot of people have sort of, they don't give themselves enough credit. They don't see themselves as being, you know, uh, disciplined enough, or they feel they don't have enough willpower. It doesn't really take any of that. It just takes making a decision that you want to be healthy, and then just learning the tools that it takes to be healthy. And I promise you, it's not as difficult as you might think. So that's my goal, is to help educate.
Okay, I got two questions from that. One popped up at the end. So one, can you go over what are some of those principles that you
Mm.
mentioned? And then two, how do you define healthy?
Okay. So the first question, what are some of those principles? These are natural health laws that we have in place. At the core of that is nutrition, making sure that you are optimizing your nutrition, is as simple as just eating what Mother Nature provided for us, right? Like, staying away from man-made stuff as much as possible. So if it comes from the earth, it comes from the ground, and you can recognize it, then that's food. Anything outside of that is not food, okay? So, eating, focusing on fruits and vegetables, nuts and seeds, whole grains and legumes are really the foundation in terms of optimizing your nutrition. And then exercise. We're very sedentary. We don't move a lot, and we're used to sitting behind a desk and looking at our computers all day. And we get home and we're exhausted, and we sit behind TV, and then it's time to go to bed, and we never moved hardly. So optimizing physical activity, just 30 minutes of walking, it's not really that difficult. You can break it up throughout the day, but just get moving. That's an important aspect. Making sure that you're drinking enough water. A lot of people drink coffee, and they've replaced water with coffee. And that is unfortunate, because coffee actually makes you even more so dehydrated. It's really, it's a medicine. I actually look at coffee as a medicine, caffeine. So making sure that you're actually drinking water, and if you're going to drink coffee, make sure that you're drinking more water to counteract the effects of the caffeine in the body.
Let me ask you this too, just to pause for a second. How much water should we be drinking per day?
Mhm. The rule of thumb is, 8 to 10 cups of water or 8 to 10 glasses of water a day. I tell people that, just take your body weight in pounds and divide that by 2. And that's how many ounces of water you should be drinking a day. So if you weigh 150 pounds, divide that by 2, you get 75. So aim for at least 75 ounces of water a day, or just make sure that when you're using the bathroom, your urine is not bright yellow. It's as clear as possible. So that's another way to sort of, get a ballpark idea of how much water you should be drinking.
And then, we can get some water from fruit, right? And hydrate that way. So if you're eating fruit, does that amount of water that you need to drink go down?
Actually, it does. The more fruits you eat, because fruits are very hydrating, 75 to almost 90%, in some cases, watermelon is mostly water, right? They're very hydrating. So yes, your need for water goes down when you eat a lot of fruits in your diet. That is correct. That's
Okay.
correct.
And I cut you off, so I don't know if you were finished with like the principles that you were
Okay.
discussing.
I got a few more. Is that okay?
Yeah, of course.
All righty. All right. So another one is sunshine. Making sure that
Mm,
you're optimizing, sun exposure, because vitamin D is a major vitamin D deficiency actually is a major issue in our society today, and is actually linked to so many of the diseases that we deal with today, like cancer, as an example, autoimmune disease. Many of this can be actually linked to a deficiency of vitamin D. So making sure that we're optimizing sunshine exposure is important, and also just making sure that we're getting air, going outside and getting exposed to clean air as much as possible, getting rest, sufficient sleep. That has been an issue for me. And I think that when I look back, I talked about cause and effect. And this is something that we all have to do in life. We have to take a step back and say, well, why did I get sick? How did I come to this present state? And for me, I know that in addition to the stress of going through medical school and residency, not getting enough sleep was a major thing for me. And even till today, I still struggle with that. So sleep is so key, because that's when healing occurs, is when you're sleeping, right? So that's important. And then also trusting God, for me, that's an important piece in making sure that you're healthy, meditating, you're having a prayer life, stress management, all of that is key in ensuring that you're healthy. So that was a response to your first question. The second question was, can you remind me what the second question was?
Oh, how do you define healthy?
How do I define healthy? Good question. I don't think that healthy necessarily equates to living long. I think it's the quality of the life that you live. That's how I would define healthy. So having, the life that you're living here on Earth, is it productive? Are you largely free of pain? Are you living out your purpose? Are you active? Are you happy? Are you emotionally intact? All of these things are an important part of being healthy. So if you lived to 88, but half of that was spent going from doctor to doctor to doctor, procedure after procedure, and just severe pain, to me, that is not a good quality of life. If I
Mhm.
could do something about it, if I had the ability to do something about it, that would just not be a good quality of life. But if I was able to live a short existence, but I was able to do all that I was called to do, live out my purpose, be happy, be joyful, that is what I consider healthy.
Okay, and I want to ask you a question about you talked about vitamin D. So I'm back in LA now, but I was living in Atlanta for 5 years, and
Mhm.
I remember that there was a time when I was just feeling super depressed, and like as a
Mhm.
human, we all can feel that at times, but I noticed that for me, it was a prolonged time of feeling that, and I couldn't really figure out why. And so then I went and got my physical, and my vitamin D levels were just like extremely low. So the doctor
Mhm.
prescribed me to take some over the counter vitamin D, right? So you mentioned walking and how important it is to get outside. And then for those people who either don't get outside or they're taking a supplement, I'm not sure if you're familiar with Dr. Jack Cruz. He talks about, yeah, so he talks about like the vitamin D supplements and how if you take those, then it kind of diminishes your body's ability to make it on its own. So I'm just kind of curious your thoughts on that.
I've never heard of that. The best way to get vitamin D is, sun exposure, right?
Hmm.
The hormone in your skin will then convert, the cholesterol will be converted to vitamin D2, and then the body will then go on to convert it to vitamin D3 to be used by the cells of the body. So that is the best way to obtain vitamin D, but we have to remember that a lot of us, especially in the winter months, we just don't have that kind of sun exposure. So we sometimes need to take a vitamin D supplement. And I see no problem with taking supplementation to ensure that your vitamin D3 levels are optimized. So making sure that you're getting a vitamin D3 supplement is important because that is the active form of vitamin D. But I've never heard, I don't know any studies that show that if you take vitamin D as a supplement, that would diminish your body's ability to produce vitamin D. I don't think that that's how it works. At least that's not what I've discovered.
Cool. We have New Life 624 wants to know, in your opinion, is soy tofu healthy for us?
Oh, yes. So this is a debate that has been going on for years and years and years. And I will just say this, that if you don't feel comfortable consuming soy, there are other ways that you can get protein, plant protein, so you don't have to eat soybeans or any form of soybeans like tofu. But, when you look at many of the studies, tofu, soy actually is pretty much a healthy food to consume. And the reason why a lot of people are concerned because it's got estrogen, but it's the form of estrogen that we need to be concerned about. In this case, soy has what we call phytoestrogen, and phytoestrogens are actually protective. And what they actually do is they'll block the estrogen receptors in the body so that you don't have that excess amount of estrogen that can then lead to things like breast cancer. So I am a huge fan of soy and tofu, and I tell people to consume it. Even if you've been diagnosed with breast cancer or you are a breast cancer survivor, I think that it's a great addition to help you as a way of protecting you from future risks of developing cancer. But if you don't feel comfortable, there are other sources of protein.
What are some of your favorite sources of vegan protein?
Tofu. I do a lot of tofu, but also I love beans. So, I
Mm.
mean, there's so many varieties, right? Chickpeas and lentils and black beans. Even I don't particularly love, what is it called? It's the tofu, the one that's fermented.
Oh,
Uh,
tempeh?
Tempeh. I don't really love tempeh, but some people like it, and so that's another great source. I mean, it's tofu as well. It's a soybean, but yeah, and nuts have some protein as well. They're a little bit higher in the fat category, so you want to be very cautious and not over consume. But those are also excellent sources of protein.
Mhm. What are your thoughts, since we're talking about like nuts and they have, healthy fats and everything, cooking with oils?
Good question. So in general, again, I always preface this question by saying that I'm in the space of reversing disease. So it's like, you go hard or you go home kind of situation for me.
Hmm.
So with that being said, we know that free oils, so oils that have been extracted from their whole sources, in the case of olive oil from olives, in the case of avocado oils from avocado, you're better off eating the olive, you're better off eating the avocado, right? Because the oil is actually prepackaged with all of the other essential nutrients like the fiber and the vitamins and the minerals. So it doesn't have the same impact in the body that it would if you were to isolate it and
Hmm.
consume it in the oil form. So I'm generally speaking, when I'm trying to help people with reversing disease, I tell them to avoid the use of oils. There are some exceptions, like flaxseed oil. Cold pressed flaxseed oil might be okay in certain situations. It's a case by case situation, but in general, I am not a I don't encourage the use of oils. If you can, try to minimize it or eliminate it altogether. And if you are a diabetic, it's very important that you eliminate the use of oils. Diabetic or want to lose weight. Yeah.
And I definitely want to touch on the diabetics next, but I'm sure some of your patients come back at you with like, well, what am I supposed to cook with? And so what do
Right.
you and how they prepare their foods if they're not using oils?
Yes, yes. First of all, I'll say this, food that has been, cooked in oil tastes good. Okay, let's just be honest. Okay, I get it, but also I think it's important that people know that your body, your taste buds will adjust. That's the beautiful thing about our bodies, is that over time, your body will start to adjust to whatever you give it. So yes, in the beginning, it might feel difficult. You might not like the flavor or the taste, but eventually your body will get accustomed to eating foods without the excess use of oil. If you're trying to saute something, you can use just water or broth. And I know it's difficult for a lot of people. It's like, what? But it is possible. And, you really just want to kind of focus on seasoning your food. And believe you me, you can actually end up with a very tasty dish without all of the excess oil.
Okay. So diabetics, you specialize in working with diabetics. Can you break down what exactly is diabetes and how it affects the body, part one? And then can you talk about the differences between type 1, type 2, and even pre-diabetes?
Okay. So type 2 diabetes is, I think it's an epidemic crisis. There are so many people living with this condition and so many people that have this condition and don't even know they have it. And I think that a lot of people, especially in the Black community, you've heard people say sugar diabetes, right?
Mhm.
And so,
It's-
people believe, what'd you say?
They call it the sugars.
The sugar, when I first heard that term, my father-in-law, said sugar diet. I was like, sugar diabetes. I never heard that before, but yeah, it is a condition that affects a lot of us, and many people don't understand really what is at the root cause of type 2 diabetes. And it's really, really an excess dietary fat issue, and not so much an issue of blood sugar. I think we sometimes, it's like you're dealing with, you're looking at the end result and thinking that that's the problem, but you're not getting to the root cause. And really, it's excess dietary fat, high fat consumption in the diet from animal sources predominantly. That is what underlines and is the root cause of type 2 diabetes. And it's this excess fat that leads to the condition of insulin resistance. So there are a lot of people that are pre-diabetic. And when you are labeled a pre-diabetic, it means that you do have insulin resistance. And this issue of insulin resistance is that the fat that you consume in your diet paralyzes the hormone insulin, and insulin is needed to get glucose out of the blood and into the cells where it belongs. So your body starts to produce more insulin in an effort to overcome this problem. And over time, the body is not able to keep up, and blood sugar levels start to rise, and you end up with type 2 diabetes. So that's in a nutshell how someone can go from a pre-diabetic stage, which already is someone living with insulin resistance, to becoming type 2 diabetic. And I think you asked me, there was another question you asked about type 1. What's the difference?
Yeah, the difference between type 1, type 2, and then the pre.
Okay. Yeah, so most people, about 90 to 95% of people with diabetes are type 2 diabetics. It's just a small number of people that are living with type 1 diabetes. And type 1 diabetes is really an autoimmune condition where the body's own immune system attacks the cells in the pancreas that produce insulin. So they are insulin deficient and they have to take insulin. So that is, by definition, the difference between type 1 and type 2. And a lot of times with type 1 diabetics, they often get that diagnosis in childhood, whereas in type 2 diabetics, usually you're pretty much an adult, although we're seeing that more and more kids are starting to become type 2 diabetics as well.
Mm. Man, I got a lot of questions about this. So I had John Sally on the show, and he talked about a time when he was at the Essence Fest, and he went on stage and he told the crowd that you could reverse having diabetes, like you can cure yourself. And so he said he walks off stage, and one of the organizers said, "Hey, no, you can't say that. Like, go back on stage and basically like reverse that." And so he went back on stage and he says that if you are diagnosed with diabetes, you can't heal yourself, but you can reverse the effects of that. So he walks off stage and basically says he got fired for that.
Wow.
So can you heal yourself and reverse type 1 and type 2 diabetes?
Okay. I think the medical community doesn't like the word heal.
Hmm.
Um, you know, because our understanding is that once you've been labeled a type 2 diabetic, you're pretty much, you might be in remission, right? Or you might be well controlled, but they don't believe that it's something that can be healed. And I don't really agree with that. I think that you can use healed, you can use reversed. I don't really care what
Hmm.
term we use. I just want people to know that, in a lot of cases, you can become a non-diabetic if you're a type 2 diabetic, right? So I know terminology matters in certain spaces, and so I try not to focus on using those labels. I just want people to know that if you are type 2 diabetic, in many cases, of course, we have to take into consideration how long you've been a diabetic. That factors in, whether or not your body is still producing enough insulin. That factors in. There are certain things that factor in, and you may need to be on medication, but you can still do a better job of managing your blood sugars without having to be on so many medications. It's a
Hmm.
spectrum. But for a lot of people, particularly if you've been recently diagnosed with type 2 diabetes, it is possible to walk that back and
Hmm.
become non-diabetic.
Okay. And then for type 1, since that's more autoimmune, is that
Yeah.
something that can be reversed or just managed?
To be honest, my understanding is that that condition cannot be reversed, but it can
Hmm.
be very well managed. I'm thinking of Mastering Diabetes, Dr. Kabata. What's his name? Dr. Cyrus Kabata, yes, and Robbie Barbaro. They wrote a book called Mastering Diabetes. I love that book. And they are both living with type 1 diabetes. And it is not, I don't believe it's a reversible condition, but I do believe that they're managing their symptoms very well. And they're using physiologic, levels of insulin, meaning that they're not using any more insulin than you and I would, in terms of our bodies producing the amount of insulin required to keep our blood sugars at a normal level. They're able to actually keep their insulin requirements pretty low because they're eating a plant-centered diet, and they're eating a low-fat plant-centered diet in order to keep their condition well controlled. So I've never seen anyone reverse type 1 diabetes. And if it was reversible, then the question is, were they type 1 diabetic to begin with? Because there are other categories of diabetes that I won't go into, like MODY and LADA. These are other sort of forms of diabetes that have kind of, some characteristics of type 1 and type 2. So the question is, were they actually truly type 1 if they were able to reverse that? That would be the question. Yeah.
Okay. How much does genetics play? So let's say a parent has either type 1 or type 2
Yeah.
diabetes, and is their child like at greater risk for developing that because the parent has it, and does it change based off of what type the parent is?
So good question. Um, I think that largely we would like to believe that I'm going to start with type 2 diabetes. Would like to believe that type 2 diabetes is a genetic condition, but it's not a genetic condition in terms of you being passed on a gene that then, makes it likely that you will develop type 2 diabetes. Actually, what is passed on is the lifestyle, the
Hmm.
dietary choices. So that is where it's more familial, right? You were in the same environment that your mother was in. They ate the same, ate the same kinds of foods that your mom ate, who was a diabetic. You're likely to become a diabetic as well if you don't make those changes. But in terms of, a gene that was passed on from your mom or your dad to you, you might have a genetic predisposition or a tendency, but you've heard this term, and maybe you haven't, genetics loads the gun, but
Yeah.
lifestyle, pulls the trigger. So you might have some genetic predisposition, but it's your diet, it's your lifestyle that really will kind of determine whether or not you become a diabetic. And so this is the conversation surrounding epigenetics. But in the case of most type 2 diabetics, it's not a genetic condition. Type 1, there is some association. There is some, they have discovered some genes that do get passed down. But again, a lot of it has to do with what the infant was exposed to. We now know that babies that are not breastfed are at a higher risk of developing type 1 diabetes. So we need to look at some of the environmental causes. But largely for type 2 diabetes, it is really not a genetic condition.
Okay, thank you for that. Your life asks, I eat avocados almost daily. Is it okay to consume them daily?
I don't see why not. I will say this though, that, if you are trying to lose weight, you might want to consider how much avocado you're consuming. But avocado is a healthy food. It's got fiber. It's got, phytonutrients. It's got vitamins, minerals. It's a health food. It's a healthy food. So yes, there's no problems with eating avocado every day. Just make sure you're not over consuming because you might have a hard time losing weight.
She also wants to know, are there any foods that can level blood pressure?
Good question. I try not to focus on one single food that you can take to reduce blood pressure or even type 2 diabetes. We live in a society where we're kind of looking for a quick fix, like what's that one thing I can just take and all of my problems will go away. It's true that we know that things like garlic can help to reduce your blood pressure. There are certain foods that you can definitely, eat on a daily basis that can help. But really what you want to focus is you want to be more holistic in your approach. And so you want to look at the things that really help you want to look at things that cause high blood pressure. And one of those things is, of course, making sure that you're physically active, that you're not over consuming on salt, sodium. That's a big issue, and making sure that you're not eating junk food. They are loaded with sodium and can cause your blood pressure to go up, and making sure that you are at an ideal body weight. So if you're carrying excess weight, that too can also lead to high blood pressure. So yeah, there are a lot of things that you can take. I think someone said turmeric. There's so many things that you can take to lower blood pressure, but really I want people to focus on how can I do this as a lifestyle so that I never have to worry about this in the future.
All right, great. Yeah, if you're tuning in and you're on Instagram, hop over to YouTube because Instagram cuts off the feed, and make sure that you like and subscribe and share this video. Question for pre-diabetics, diabetics, what are the absolute things they should definitely cut out of their diet, and what are like the best things that they should eat and add to their diet?
Yeah, wonderful. So for a type 2 diabetic or someone who's pre-diabetic, one of the things that I tell those individuals to do is they really need to focus on avoiding saturated fat in their diet. And saturated fat comes mainly from animal products.
Mhm.
So really cutting out, limiting, if at all possible, avoiding anything that has a face, right? So meat, cow, poultry, fish, all of that, you really need to bring that down to a minimum. And if at all possible, like I said, avoid that. Because again, like I said, the issue of type 2 diabetes and pre-diabetes is insulin resistance. And what causes insulin resistance is when you have excess dietary fat predominantly saturated fat. It paralyzes the hormone, doesn't allow insulin to work properly, and blood sugar levels stay up. So you really want to avoid animal products as much as possible. I also tell individuals to avoid free oils, the use of oils. If you need something fatty, eat it in its whole state, but try to limit, seed oils. I don't consider these to be health foods. So those are the top things that I want my pre-diabetics and diabetics to do. And also making sure that you're exercising. Exercising actually helps to make your insulin receptors more sensitive, so that insulin can actually do its job of reducing your glucose in your blood, and carrying it out of your blood and into the cells where it belongs. So exercise is an important part also of managing diabetes.
Mm-hmm. And now, is this any form of exercise, yoga, walking, is weight training better, resistance training?
Making sure that you're getting some aerobic exercise, so walking or running if you like, or jogging, doing that at least 25 to 30 minutes a day. Strength training, resistance, all of that is important in terms of, keeping your bones healthy and strong. But really, when we're talking about diabetes, we really want to focus on aerobic exercise, and walking is a great form of exercise. Just make sure you're getting your heart rate up. That's
Okay. And I see a couple copies behind you. Can you talk about your book, and 10 strategies for weight loss without compromising health? And can you reveal like one of those ways?
Oh, sure. Yeah, thank you for highlighting that. So I just recently co-authored this book with a friend of mine, a colleague, Dr. Davin Kaniaru. And we felt it was necessary to write this book because there's just so much information out there about how to lose weight. And I feel that a lot of the information regarding how to lose weight often will compromise your health in the long run. And I'm thinking of, some of the other diets outside of plant-based nutrition. And while they might give you some short-term gains, like you might lose weight, you might feel good, the long-term effects of those diets may not be so good. So we wanted to give people strategies, important strategies on how to be able to lose weight and to do it sustainably, right? To lose the weight and to keep it off without actually harming their health. And in many cases, helping your health and reversing disease if you have disease. So this is a book for people that want to lose weight, but also for people that are diabetic, people that have autoimmune disease, people that have chronic disease, chronic lifestyle related diseases, people that are dealing with high cholesterol. This book is for you. You asked me to tell you one of the strategies in the book. Eating whole foods is one of the strategies that we discuss. And I think it's important that people understand that highly refined and processed foods are not food. These are foods that is really why we're sick today in our modern society. They are filled with additives and chemicals, and they are also stripped of fiber in most cases. A lot of us are dealing with constipation because of that. Fiber and all of the vitamins and the antioxidants, these are things that keep us healthy and free from disease. They are depleted of those protective compounds. So we want people to focus on whole foods. If it looks like something you can recognize out of a garden, out of the ground, then that's what we want you to consume.
Okay, great. Dr. Lena says, with consistent lifestyle changes, have you seen people decrease their blood pressure?
Absolutely. I tell people it is actually a lot easier to reverse blood pressure, diabetes, cholesterol. I've seen it time and time again by making some of these simple changes. It is totally doable. I think in the area of blood pressure, one thing that isn't discussed enough is the importance of making sure that we're not using salt. So I don't think that everybody has to be salt-free. I think it's an individual thing. Some people are salt sensitive, right? So they may have to avoid the use of salt, but most people can actually keep some salt in their diet. But what I tell people to do is cook your food and then have the salt on your table and then add it to your plate. Once you've served yourself, add the salt to your food, and that way you know that you're not over consuming on salt. But sodium is a big contributing factor for the development of high blood pressure. But yes, to answer your question, I've seen it many times.
So for those who it's okay for them to have salt in the diet, what type of salt should they be using? Should it be that I don't even know the name of it, but it's the blue label that everybody uses, or should we go with like sea salt, Celtic sea salt, Himalayan sea salt? What's the salt we should be using?
If you can be salt-free, I recommend that. But if you cannot and you want to use some salt, that's fine as well. I think that, using trying to avoid refined salt is really what you want to stay away from. You want some of your salt to still have some minerals in it. So pink Himalayan is a good one. Celtic, sea salt is another good one to use. Those are black salt, namak kalam or kalam namak. I can't remember how it's said, but it's black salt. Those are all fine to use because they still have some of the minerals, intact, still in the salt. You don't want to consume salt that is refined. But it is important to note, though, that if you're going to consume things like pink Himalayan salt or Celtic salt, that you make sure that you are optimizing your iodine. So you want to make sure that you're getting some iodine in your diet if you're going to consume unrefined salt.
Okay. You can still hear me, right?
I can't see you, but I can hear
you. Yeah. I'm trying to figure out the camera just disconnected for some reason. So I'm going to work on getting that back up. But also, since we talked about your book, where can people find it and get a copy?
It's on Amazon, so they can just go directly to Amazon and they can type type in my name, Dr. Teju Williams, or just talk Dr. Teju Williams, and it'll pop up, and they can purchase it there.
Okay, perfect. You emphasize the importance of dealing with emotional trauma as a part of healing. How do you do unaddressed traumas manifest physically in the body?
So this is an area of wellness that I kind of stumbled upon. I've always, I used to hear people say, stress kills, and I'm like, well, how does stress kill? And how does stress really impact? We're always under a lot of stress. Like, what are they talking about? And it wasn't until I started to have some of those issues myself, health issues, did I realize that actually not just the stress of my day-to-day living, but also some of the emotional stress that I had been under. Moving to the United States was pretty stressful at the age of 10, and kind of learning the culture and learning how to kind of fit in with the system, that was also stressful. Going through school was stressful, and also just as Blacks, we're dealing with a lot in our society, and that can also be that's a huge source of stress for us. And when you understand that stress actually impacts your immune system, and your immune system is what keeps you healthy, then you realize that we really have to get to the root cause of why we are sick, and stress is a big part of it. So I really had to be honest with myself, and I think that that's a thing that I want people to take away from this conversation is you really have to be honest with yourself about the issues that you're dealing with, right? Like, look yourself in the mirror and just be raw with yourself and think back on some of the issues that you might have dealt with as a little girl or as a little boy, and really start to try to work through that. And there are a lot of different ways you can do that. You can get a therapist. I'm definitely all for seeking therapy, talking to somebody, though, that you trust and that will not diminish your experience. I've had a lot of, bad experiences with people that just want to negate your own experience. You don't want someone like that. You want to find someone. I think that if you're dealing with emotional trauma that, is related to discrimination, or, you need to find somebody that looks like you to help you go through that. That's just, that's a fact of life. But just seeking out therapy, making some changes in your lifestyle. Sometimes for some of us, we may have to kind of move away from the career path that we've chosen and find a different career path. Like, you just have to be honest and be willing to do the work and just do what it takes. Don't worry about what people think, what society's going to say. You're not a failure. You just have to move in a direction that best serves you. But really dealing with that is an important aspect of getting healthy and finding resources, books. I have a lot of books that I've read on how to deal with and work through emotional trauma and stress. So those are just some of the tips that I would leave with your audience.
Okay. And we started off, I played a video for an upcoming retreat that I have going. So it was 3 years ago, was the first time I even heard the word ayahuasca, right? And so I
Yeah.
went to an ayahuasca retreat in Costa Rica. And like for me, I've said this on the channel many times, it's the best thing that I've ever done, right? And I found it to be an incredibly healing experience. And, a lot of people go and work with the medicine for different reasons, for trauma being a big reason that people will go and find that healing. So I'm just curious, in your experience and working with patients and everything, how
Mhm.
familiar are you with like plant medicines and working with these different, you know, medicines that nature provides, so to speak, and have you seen any benefits from that?
Yeah. To be honest, I don't have a lot of experience with plant medicine in that regard, in terms of dealing with emotional stress. But I've heard people, speak on how it's been transformative, and how it's been helpful. But I can't speak to that because I don't have a lot of exposure or experience with that. But I have heard people speak on how that's been beneficial for them in some cases. Yeah.
Okay. Yeah, I was just curious. You you mentioned finding God's design for the body, right? I'm just curious, like how much and how does faith play a part in how you practice?
Yeah, it's how I move, it's my identity. I don't impose, obviously, my faith on others, because I want to be respectful, and I think everybody has the right to choose how they want to move through life. But, for those that are interested in incorporating faith, I think it's a powerful tool. I believe that God has created us, and because He's created us, He has the manual for how our bodies ought to be taken care of. And if we comply with those laws, then we have a better chance of being healthy. So, I have a lot of patients. I've had a lot of patients in the past that, are faith based and, don't mind talking about, faith. And sometimes I pray with my patients if they're okay with it. But it's definitely an important part of who I am. But like I said, I don't impose that on anyone.
So we hear a lot of times, who heals the healer and where does the
Mhm.
healer go, right? I'm curious, what's your self-care routine look like?
Um, I have made a lot of adjustments. I think I mentioned this earlier in our conversation that I've had an interesting journey with my health, and I've had to make a lot of different adjustments throughout this journey. So for me, self-care is really just doing what I want to do. I think
Mm.
for a very long time, I was kind of in this box of I'm a doctor, so I'm going to practice medicine like every other doctor does. And I was like, but this is not making me happy. So I made the decision to step away from conventional medicine, and really focus on holistic. Um, so that for me was a version of self-care that it took a lot of courage to do that. But that was what I needed to do. That was necessary for me because that more aligned with my purpose in life. Also, getting enough sleep is part of, like, I try my best to get to bed early. I don't always do it, but I try my best to get to bed early because for me, if I don't get enough sleep, I don't function well during the day. So sleep is important for me. And then laughter. I try to include laughter in some part of my day, whether it's watching some comedy show or a movie, just something, because I can be a very serious person at times, and I have a very type A personality. So I've really I'm trying to work on kind of just being a little bit more light and sort of just kind of just going through life, not being so rigid. So still finding my way, but those are like the three core things for me.
Yeah, I love that. I love that.
Yeah.
So, for what tools would you suggest people look into that want to learn more about using food as medicine and
Mhm.
healing in, a holistic manner?
Yeah.
Obviously, one, we want to shout out the book. So grab the book,
Yes,
grab the
yes,
books
yes, yes.
available on Amazon.
That's right. That's right. Thank you. Absolutely. Our book is a great resource. But there are many other resources. Gosh, there's so many of them. My favorite book of all times, actually two, is by Dr. T. Colin Campbell, The China Study, and also Whole. Those are two books that I absolutely love. And I think that people will get a good understanding from a scientific perspective, because I think some people think that this might be a little woo-woo, like out there, like, oh, it's not science-based. It's very much science-based. We actually have a whole entire specialty called lifestyle medicine, focused on disease reversal using nutrition and food as medicine. So this is science-based. This is not just something that somebody just like cooked up. So I think that those two books would be a great resource. There are Physician Committee of Responsible Medicine, PCRM, is another really great resource for people that really want to learn more about whole food plant-centered diet. And then documentaries like Fork Over Knives and What the Health and many other, there's so many documentaries on YouTube that will help you understand also how important it is to eat a plant-centered diet. There's so many, I can't list them all, but I would just start with those books and PCRM, and then some of the health documentaries.
Love it. I love it. Okay, Dr. Williams, what is the most important takeaway you want viewers to walk away with from this conversation?
For me, I think it is understanding that you have free will, you have a choice. And one of the things that bothered me in medicine was we were taught this idea of informed consent and this idea of autonomy. And informed consent is giving patients all of the options, right? If someone is diagnosed with something, we tell them, okay, these are the pros and cons to all of these options. And we don't do a good job of that. I think that nutrition should be on the table as one of the options we give our patients in helping them, manage or reverse their condition. And so I want people to take away from this conversation that you are your first healer. You can go to any doctor you want, but it starts with you. And taking ownership of that, taking responsibility for your health, like starting with you first, I think is an important step in helping you to navigate your health. And you'll find that when you do that, your need for drug medication, your need to be dependent or reliant on the healthcare system as we are today will be very much reduced. So just taking ownership, accountability, and doing the work, and looking within and not so much outside of yourself for the help and the resources you need to getting healthy is what I want people to take away from this.
Amazing, amazing. Well, Dr. Williams, you are
Yeah.
welcome on the platform anytime. I hope you will come back and have another conversation with us. And yeah, thank you for coming through on your Sunday, taking the time out of your schedule and just dropping a lot of helpful information. I learned something. I'm sure the audience learned something. Send this video to your family members, watch it again, and notes, and eat more whole foods.
Yes. Thank you so much. It was an honor and a pleasure to speak with you. I appreciate it.
Okay, I hope we do it again soon. Enjoy the rest of your day. We'll catch
You
y'all on
too.
the next one, Tribe.
Bye.
Bye.